Hello everyone, thank you for listening to me. I'm Barry Seemungal. I'm a vestibular neurologist and I'm the new head of the neurology unit at Imperial College London. A little bit about me, I did a PhD in clinical vestibular neuroscience about 20 years ago at Queen's Square in London, the Human Movement Balance Unit under Professors Adolfo Bronstein and Michael Gresky. So I'm going to talk about patients with vestibular dysfunction following traumatic brain injury, and these cases are amongst the most complex and interesting patients that I see. So how do we simplify and make sense of this? So I think the way to start is to have a sketch of the functional neuroanatomy of the vestibular system. So as you know, the inner ear mechanism detects head movement and sends signals of head motion into brainstem and cerebellum circuits for further processing, which mediate reflex outputs, but also perceptual outputs of self-motion sensation, also mediating postural control and spatial orientation. In my talk, I will walk the audience through these different elements of the functional neuroanatomy of the vestibular system, and I will support my talk with data from our own work, but also from others. And I will provide additional insights from our current and the future clinical work. And having seen patients with acute traumatic brain injury for the last several years, I will also discuss the clinical and practical approach to these cases and highlight areas for further research in areas where we know little about. I will deal with common inner ear problems like benign paroxysmal positional vertigo, the incidence, risk factors, and its treatment. I will deal with patients with cerebellar dysfunction. I will also talk about the manifestations and testing of these different dysfunctions. And I will also introduce some new concepts. So concept of vestibular agnosia, in which patients with acute traumatic brain injury have a severely attenuated sensation or vertigo. And we published our first findings of this syndrome in Brain this year in 2021 in acute traumatic brain injury. This is an important clinical syndrome because it's linked to postural control, but also to a reduction in the recognition by clinicians of common inner ear disorders such as BPPV, benign paroxysmal positional vertigo. Finally, I will also touch on functional neurological syndromes in traumatic brain injury, which in fact are very uncommon in the acute setting, but I'll also suggest mechanisms for the development and hence possible ways to avoid development of these chronic functional disorders after traumatic brain injury. So I hope you will join me in my talk when I will present our interesting and exciting data, but also bringing information from the wider research community and hopefully allow you to manage your patients in a better way. Thank you.